All right. So adrenomimetics. These are sympathoagonists. In this pharmacology video series, we are talking about autonomic drugs. Uh, so we did parasympathetic agonist and we did parasympathetic antagonists. Now we are going to talk about sympathetic system and sympathetic agonist. So after this video, we will talk about sympathetic antagonists. So first is alpha 1. It's a You have to remember these, what are the receptors and where are the receptors, and what the sympathetic nervous system does. So that is what is going to do by the drug. So there is alpha 1 receptors, alpha 2 receptors, beta 1 receptors, beta 2 receptors, beta 3 receptors. So first is alpha 1 receptors. Alpha 1 receptors are located on the peripheral smooth muscle. So when these receptors are stimulated, vasoconstriction is the action. So next, alpha 2 inhibit neurotransmitters released from centrally inhibiting sympathetic flow. It inhibit the sympathetic flow. Even though this is sympathoagonist, it it is alpha 2 receptors, and the drugs bind to alpha 2 receptors will seem centrally inhibiting sympathetic flow, like alpha 2 agonists, like in clonidine. So in hypertension, you could use this clonidine. It will decrease the sympathetic outflow. Next, the beta 1 is in the heart. In sympathetic system, it will increase heart rate, and as a consequence, it will increase the blood pressure due to also the peripheral vasoconstriction. Next, the beta 2, bronchial smooth muscles and uterus, bronchodilation and uterus relaxation. So we are talking about sympathetic nervous system. So why do we need to dilate our bronchial muscle in sympathetic system? Is we need energy. So it is a exciting stage, no, in the body. So in the parasympathetic, we don't need to more oxygen in the body, but here we need to breathe fast. When you are in fear, you breathe fast. When you are excited, you breathe fast, and bronchial smooth muscles are dilating. So the beta 2 is in the bronchial smooth muscle. So that is which drugs that could increase or they activate beta 2 receptors, like beta 2 agonists. So those drugs we use to treat asthma, bronchial asthma, COPD, and that is why this is very important. And uterus will be relaxed. So uh, beta 3 is in the fat cells, increased lipolysis. So um, for the obesity, you could use beta 3 agonists, right? There are some restrictions of the drugs that we could use, but it will increase lipolysis, because in the sympathetic system activator you need energy. So you need to degrade your lipids and get more energy. So this is the main receptors: alpha 1, alpha 2, beta 1, beta 2, beta 3. Alpha 1, it is in the peripheral smooth muscles. Alpha 2, in it is inhibits centrally neurotransmitting release. Actually, it is inhibits sympathetic flow centrally. Beta 1 is in the heart. Beta 2, very important, it's in bronchial muscle. And beta 3, it is in the fat cells. So there's a classification: direct acting, indirect acting, indirect acting, and also mnemonic also. Direct acting adrenomimetics. Mnemonics: mad step on cliff. So M means mirabagrone, A means albuterol, D means dopamine, dobutamine, S means salmeterol, salbutamol, T means terbutaline, E means epinephrine, P means phenylephrine, O means noradrenaline, C means clonidine, I means isoproterenol, F means formoterol. Next, indirect ones. AC, amphetamine and cocaine. Direct and indirect one: PEP, pseudoephedrine and ephedrine. So these are the classification and the mnemonic and the drugs. So we have to know what is the drug, what is the receptor, why do we use them, and finally contraindications. So in the epinephrine, also called adrenaline, very important drug. It will activate alpha 1, alpha 2, beta 1, beta 2, those four receptors. All right, they could use in acute asthma attacks, Most importantly, allergy happens, anaphylactic shock happens, shock, epinephrine injection, anaphylactic shock. And also we use adrenaline to local anesthetic to increase the duration of action. We know these act on alpha 1 receptors and um, constrict the blood vessels. So when a local anesthetic is released, due to that reason, it will release slowly. So duration will be increased. So epinephrine, nothing but anaphylactic shock, and also to increase the duration of action in the local anesthetics. Next, no epinephrine, uh, alpha 1, alpha 2, beta 1, no beta 2. Okay, alpha 1, alpha 2, beta 1, also shock. Next, isoproterenol. This is beta 1, beta 2. Because of it, enhanced beta 2 receptors, we could use for the bronchial asthma. So in isoproterenol, you have to remember this beta 1 receptors are in the heart, no. So if the patient is already tachycardic, you can't give isoproterenol because it will uh, increase the action of these receptors, beta 1, beta 2 both. So we need more selective drugs. That's why we use beta 2 agonist, not isoprene. You could use if the patient's heart is good, but there's a risk, right? In dopamine, next the drug is dopamine, it is D and beta 1. It is used in congestive heart failure and shock, congestive heart failure and shock. You could use dopamine and dobutamine also beta 1, congestive heart failure to increase the cardiac output. Next, the phenylephrine is a alpha 1 receptor drugs. And as a nasal decongestant, there are many famous nasal decongestant drug. One is phenylephrine because of the alpha 1 is constrict the smooth muscles. Next, the clonidine alpha 2, we talked about it earlier. It is central acting alpha 2 agonist. It will decrease this sympathetic outflow centrally. So you could use in hypertension. Next, very important, beta 2 agonists, terbutaline, salbutamol, albuterol. These are beta 2 agonists. These drug mainly used in bronchial asthma because of the selectivity beta 2 in bronchial asthma. And as tocolytics, why it it is prevent for the premature labor. Tocolytics are what? Uterus relaxants. We do not need now baby to born, so we, premature, it's very early to birth of the baby, so we use tocolytics. So beta 2, um, you could use, right? Next, the amphetamine alpha beta cns act as a cns stimulant in attention deficit syndrome in children. And ephedrine alpha beta cns, ephedrine is more famous for nasal decongestant. And we have to remember these sympathetic agonists are contraindicated in hypertension and hyperthyroidism. Because in the hyperthyroidism, because of the T3 T4 action, thyroxine triiodothyronine action, the sympathetic outflow is very high, and heart rate is also high, sweating and everything. So we do not need to excessively or exaggerate the situation by giving sympathetic agonist. If patient is hypertension, you usually does not also uh, take this sympathetic agonist drug. So in here, these terbutaline, salbutamol, albuterol, salmeterol, these drugs we will talk about in respiratory system drugs. So these are, you have to know, those that's inhalers that we use, they contain beta 2 agonist drugs because beta 2 receptors in bronchial smooth muscles, when it is activated, broncho smooth muscle will be dilated. Okay, so um, these are the main things that I have to bring it on. But remember about epinephrine and no epinephrine and also beta 2 agonist mainly. All right. um, okay, thank you.